My name's Ben-Moshe and I am the director and founder of Life Wellbeing programs. This was not my role for many years. There we go. For many years I lectured in health promotion and public health at La Trobe University. So I sort of shuddered a little bit when I saw the learning management system outside. I spent many years working with LMS and many years working with students to try and improve their health and well-being. But I suppose what I found when I was in that learning environment, as much as in theory it was a learning environment, it was actually a bureaucratic environment before it was a learning environment. And I was getting, I suppose, increasingly more frustrated. And then out of the blue, around 5 years ago, my world turned slightly upside down when I got a diagnosis of bowel cancer. And so all of a sudden, I really was forced to reevaluate my whole life, my priorities. And I suppose what happened during that time was it was a very reaffirming time for me. It was, I mean, if this is a learning, management conference, this was definitely, I suppose, one of the greatest life lessons that I have learned. In as much that illness, for most people it presents as an obstacle, as a challenge. And the great thing is about challenges, with the right mindset, they are growth opportunities. So what happened for me those 5 years ago was I really used this opportunity to grow. And I'd actually trained as a laughter wellness facilitator probably, 3 or 4 years prior to this diagnosis. And I suppose in many regards I sort of wore that personality outside of myself, in that I was really happy to run laughter sessions and mindfulness programs for other people, but it sort of never dawned on me that maybe this was actually for me. Maybe this is something that I really need to integrate into my own life. And as I say, when I got the bowel cancer diagnosis, I think one of the first signs from the universe was, Roz, you actually need to do this, because 3 days prior to I opted, basically, it's like with any cancer diagnosis, they're all different levels, and I had a malignant polyp. There were cells outside of that polyp, and I was left with options. Options are really good, but they can also be, quite stressful. And I opted to have a full bowel resection, because even with all of the amazing modern advances in medical technology, they cannot figure out a way of assessing the lymph nodes without actually doing a full bowel resection. And I was sort of given a 3 to 5% chance that the cancer would have spread. And with a 12 and a 15-year-old boy and husband and life that I actually wanted to be leading, I went for a full bowel resection. Slight catch was just where it was in the bowel. It meant that I was fitted with thank goodness, a temporary ileostomy. So for 4 months, I basically had to wear that bag. But anyway, so months and months prior to this diagnosis even be anywhere near, my reality, I had been booked for a ladies' lingerie laughter party. And it transpired that this ladies' lingerie party was booked 3 days prior to surgery. And naturally, it was the last place in the world I wanted to be. But I was very much forced to, I suppose, put that laughter wellness mindset into place. So, with lead weights, I sort of, rock up to this event and try and put on a happy face. And it was amazing, because even though initially, obviously, there was a tremendous amount of effort and psychological convincing on my behalf, in a very short space of time, using laughter, simulated laughter, it was amazing. The lead weights that had descended upon diagnosis just instantaneously lifted. And I thought, I have a sneaky suspicion that this actually, the laughter and the laughter wellness whole thing is very much a part of my journey. And it very much was. So over the course of that year, with, you know, a couple of operations and recoveries, I suppose I really needed to reevaluate my own healing and what worked for me. And I started journaling, and very soon realised that as much as I was writing for myself, I was actually writing for an imaginary readership. And I think that really helped me get through this. I was sort of posing questions to this imaginary readership, you know, well, what would you do if you were in this situation? Or, you know, and I would start to experiment with various healing modalities, visualisation and other mindfulness techniques. So pretty soon, actually, slide person, is a slide person there? Do you mind just popping the next one? Thank you very much. So essentially what transpired over the next year, without me even realising it, was that I started to develop my own wellbeing framework. And this wellbeing framework was composed of everything basically incorporated into it might not have been every day, but essentially as a philosophy that really got me through and really helped, I suppose, grow me as a person. So things that I did with the, mindfulness, developing an optimistic style, which is really important, because especially when you are, you know, going through a challenging time, it doesn't matter whether it's illness, whatever it is, the first thing that tends to go is that sort of optimistic style. You think, oh my God, this is just the worst thing ever. How the hell am I going to get through this? And it's really, really easy, I think, to sort of fall into that negative mindset. So it's looking at ways in which you can actually put a positive spin, and it's not to sort of say, you know, gloss over everything and say that everything is fine and dandy, but it's perhaps looking at ways that you can think about your current negative or stressful situation in less permanent talk. So sort of giving it a bit more of a temporary position. So, you know, today, for example, you know, was a really bad day. But it's not like, you know, every day is just absolutely the worst. So that was really important, and it was really challenging. And for me personally, I think that writing was one way that I could actually really grapple with some painful situations, take a little bit of a step back and reframe it. And it was possibly the most challenging thing that I had to do throughout the whole time, was actually trying to orient my mind to an optimistic style. And I suppose one of the things that when you have, you know, something taken away from you, whether it's your health, whether it's a relationship, whether it's work, I think one of the first things that can go out the door is your empathy and compassion, because you just feel so sorry for yourself. But it's amazing when you actually start to think about how fortunate you are and what you do have, and looking about, you know, other people you'll always find somebody who's worse off than you. It's quite staggering, and it used to really hit hard. I would find if I was having a day that I was really not feeling, you know, great, and it was amazing. Then out of the blue, someone who was in a far worse situation would almost just present themselves right in front, and I would have tremendous empathy and compassion for them and for myself. And I think that's a really important thing that we tend to forget, that we sort of think that compassion is other-focused. It's not just other-focused, it's about having compassion for yourself. And laughter. Who here likes to laugh? Yeah, it's good, isn't it? And do you believe that you laugh as much as you would like to laugh? Okay, so what are some of the things that hold you back from laughing as much as you'd like to? Anyone got to say anything? Don't be shy. Okay, let me tell you something. I'm going to do this differently. Can I have a show of hands? On average, do you think you would laugh between 1 and 10 times a day? If we have a show of hands? Yeah, maybe 1 and 10? Okay. Anyone sort of 10 and 20 times a day? Okay, excellent. Anyone, I don't know, 20 to 30 times a day? Fantastic. Anyone over 40? Okay, cool. How many times a day do you think children laugh? 10, 20, 30, 40, 50, hundreds? Exactly. Okay, so they've done research on this and they've shown that adults laugh between 10 and 12 times a day, okay? Now, I often ask this question at groups that I talk to, and honestly, I don't think, well, unless I'm working with kindergarten teachers or lifestyle staff in aged care, you know, so it's part of their brief to entertain, on average, I'd say adults laugh somewhere between 1 and 10 times a day. Now, children, they say, laughs, you know, a couple of hundred times a day. So what are some of your thoughts? Why do you think that we might sort of pat ourselves on the back, and I think it's fantastic that you may laugh 30, 40 times a day, but in comparison to children, there's definitely a discrepancy. So what do you think happens? What are some of the reasons why adults laugh so little and children laugh so much? Any thoughts? Responsibilities, yep. Anything else?
It's not very professional.
It's not very professional unless you're a laughter wellness professional, and thank goodness I am. You're absolutely right. It can be viewed as being not professional. What are some other thoughts?
Do it on the bus and you get more crazy.
Yes, it's true. Yeah. Yeah. Okay, so I'm sure you could all come up with some really, I was going to say good reasons, but I'm not sure how good they are, because at the end of the day, it's something that I've been researching. I'm still with La Trobe University in an adjunct capacity, and I do research into laughter. And one of the things, it's so simple. Children laugh from the heart. They don't think about it, they just laugh. They laugh when they're playing, they play a lot, and everything seems to be funny. And then as we grow, as we get conditioned, we start to think more about laughter. And you were saying you spent some time in the UK. I don't know whether you had this experience, but I also spent some time in the UK. And it got to the point where people would say, "That's really funny. That's so funny." And I'm thinking, if it's so funny, where's the laughter? So people start to really intellectualise. They start to laugh from the head and not from the heart. So one of the things that I'm very conscious and very mindful about is bringing laughter back to the heart, because laughter is an amazingly good thing for our health and well-being. It's not known anecdotally as the best medicine for no reason. It helps with heart rate, lower blood pressure, decreased stress. If you try laughing without breathing, okay, you can't. It's a really amazing aerobic activity, and we all know the benefits of aerobic activity. It helps stimulate the lymphatic system. It gives your abdominals a great workout. In fact, I'm sure you're going to be doing a lot of sitting around and listening to people over the course of the day. We'll continue with this framework afterwards, but let's just start with a bit of a morning giggle. The one thing that I just want to preface is, initially you're going to think this is really weird. And you know what? You're right, because we're not used to laughing without that humour aspect. But the great thing is that your body can't think. Your body can only feel. Your brain is doing all the thinking. But if you choose freely to actually participate and laugh, you're getting all of those wonderful health benefits, those feel-good hormones and some of the other benefits that I just mentioned. So just while you're sitting there, let's just smile to someone. Just put a smile on your face and just note how it feels when you smile. It feels pretty good, doesn't it? And the amazing thing is that just through a humble smile, you can change your whole physiology. They've done studies where even just putting a pencil in your mouth, they've shown that endorphins are released. Go figure. But it's true. So let's just see, just while we're there, I just want to just do a little bit of a practice laughter exercise. So put your hands just gently around your throat, and I just want you just to do a little giggle and feel the laughter vibration, okay? Let's just give it a go. Turn to someone as well, it helps. Fantastic. Okay, and we're going to deepen that laughter just a little bit down into the chest, okay, with a ha. See if you can feel the laughter into your chest, okay? Brilliant. And now that really deep belly abdominal laugh, just like we like to breathe deeply, and it's one of the quickest ways to induce what's called a relaxation response, those feelings of calm. Let's get some deep belly laughing, okay, with a ho, okay? Fantastic, fantastic. So I've got absolutely no idea how long we've got to go. Sorry, only 2 minutes. Oh my goodness me. Okay, so I'm just going to quickly go through this, and then we're going to do the most mini of mini mindfulness practices. So basically, going back to this framework, so we've got the laughter, and it's simulated laughter, because the reality is that there are many days that you do not have an opportunity to laugh, where you do not feel like laughing, but they are the days that actually you probably need to laugh the most. It's really important in terms of your own well-being, and this was something that, I was forced to look at as, what makes you unique? What makes you you? Are you leading your life, or are you leading the life that your parent wants you to lead, or your partner wants you to lead, or whatever? So really taking a hard look at what makes you you and walking that path. Having goals, vision, it's really important. Otherwise you sort of flounder. You just sort of, it'll happen sometime or it won't. I'm sure I don't need to tell you all about goals and them being smart, specific, measurable, attainable, realistic, time specific. I'm sure you're all familiar with that. Happiness. Happiness is really important. It's not one of these fluffy things that people think, The reality is that if you ask most people what they would like to be, most people would say, well, they might want to be richer, but they also want to be happier. So looking at ways that actually make you happy. And they're not necessarily those once-in-a-lifetime things that may or may not happen. I try and break down happiness into things like micro moments of happiness, micro moments of joy. What micro moments of joy or happiness are you going to include in your day? Okay, so whether that's a walk, whether that's catching up with a friend, whether that's having a little nap, whatever it is, but don't just keep putting it off. Teamwork, who's on your team, and I suppose ensuring that, as much as possible, you have people that nurture you and are the right fit for you on your team. Eating well and exercising, and relaxation, which is what we're going to be ending with. I know we've probably got a minute or less, but I just thought, before the day formally begins, let's just do a really quick 1 minute. Can I get an extra 1 minute, please? Thank you. They didn't say no, so we're going to go with it. I can just invite you to close your eyes, and connecting with your breath is one of the quickest and most effective ways to get those feelings of calm. So if you just take a couple of nice deep breaths in and out, and once more in and out. And I'd like you now to imagine a gentle wave of relaxation is passing throughout your whole body. And it's going to begin at the crown of your head. Might have a shape or a colour, and this gentle wave of relaxation is going to pass through the crown of your head, down your forehead and your cheeks, releasing and relaxing any stress in your face as it moves down through your upper arms and your lower arms. And take another couple of deep breaths in and then out, and once more in and out, as this gentle wave of relaxation passes back up through your arms, down through your chest and your belly, releasing and relaxing, as it passes down through your upper legs and your lower legs and then out through the soles of your feet. And I'd like you now to place a smile on your face. It might help you to think of a time when you were unconditionally loved, where everything was going so brilliantly in your world. It couldn't have been better. And I'd like you to sit with this smile and note some of the feelings that come up when you've got this beautiful life and love-affirming smile on your face. How your face feels with this smile. Your eyes, your lips. And I'd like you to breathe this smile deeply in. And then as you exhale, I'd like you to imagine that this smile is now permeating, it's spreading through your whole body until every cell, every tissue, every muscle, every fibre of your body is smiling back at you. And just sit with that feeling and note how it makes you feel. Breathing that smile in and sharing that smile with your whole self. So you're actually in a whole, full body smile. And know that at any time of the day, just by putting a smile on your face, you change your physiology. You orient yourself to a positive mindset. So just sit with that smile just one moment longer. And then when you're ready, if you open your eyes. And now I'd just like to thank you so much for listening to me. I hope you have derived some benefit from it. I have written a book as well called Laughing at Cancer, My Healing Journey, to promote yours, which will be out hopefully soon. Just need to find a publisher, that's the only thing that's missing. So my company's Laugh Life Wellbeing programs. I run programs based on, what I found that's really been helpful to me. As I say, everything has a learning dimension, and it's just what you do with it. So thank you very much. Enjoy the rest of your day.